Good morning. All right, so this is Eunice with Florida Training Academy, bright and early on a Friday morning. Happy Friday. Happy Good Friday, everybody. We are going to review medical terminology this morning. Because I didn't pre schedule this, I want to give people a few moments to actually enter the chats. And again, this is Nurse Eunice with Florida Training Academy, and we're reviewing medical terminology, and we'll get started in about 30 seconds. All right, so everybody, here we go. What does the prefix hypo in medical terminology mean? Does it mean above, below, fast, or slow? All right, giving you a few minutes to enter your comments in the chat. And the correct answer, everybody, hypo means below. So the prefix hypo indicates a deficiency or below normal. For example, hypoglycemia. And I will type that in the chat. So if your patient is experiencing a hyperglycemic episode, hypo, that means that their blood sugar is lower than normal. All right, number two, which suffix? So a prefix is the term before a word, and the suffix is a term after the keyword. So which suffix is commonly used to denote inflammation in medical terms? Is it A, itis, B, ology, C, ectomy, or D, osis? And we'll give you about 10 seconds to start putting your answers in. All right, let's see, let's see. Good morning, good morning. And you are correct. It is A, itis. For example, sinusitis, an inflammation of the sinuses. So a explanation is suffix or itis refers to inflammation. All right, number three, in the term gastroenteritis, the root word enter refers to which part of the body? Gastroenteritis. What does the word enter refer to? Is it A, stomach, B, liver, C, intestines, or D, kidney? Revealing the answer in three, two, one. Good morning, good morning. And the answer is C, intestines. So the explanation, the term enteritis refers to the inflammation of the intestines. However, gastroenteritis refers to the inflammation of the stomach and the intestines. So if it's just enteritis, that's inflammation of the intestines alone. But gastroenteritis, and this word is misspelled here, refers to the inflammation of the stomach and the intestines, as you can see in the photo there. All right, number four. What does the abbreviation MRI stand for in medical terminology? MRI. All right, is it A, medical radiography imaging? Is it B, magnetic resonance imaging? C, microscopic retinal investigation? Or D, medical research institute? And good morning. I do see some correct answers coming through. All right, and the correct term is going to be B, magnetic resonance imaging. So MRI is a medical imaging technique. And as you see there in the photo, so usually if your patients have to go to the MRI, as far as nursing is concerned, we may have to sometimes give patients something to calm them, something that's going to relax them, because they're going to be put into a loud machine that actually use magnets. So it's really important that if you're transporting a patient downstairs, that you and your patient don't have anything magnetic or any metal, because they can be sucked into the machine. So that's just, extra information. But sometimes you have to transport patients in the hospital. So if you're taking them to the MRI, your badge or something has on metal, your cell phone, you do not want to take it into the imaging suite. And I do want to backtrack, everybody, because I now have my online CNA course. It is complete. Yay, it took a while, but in order for you to access the online CNA course, which is good nationwide, we have a test bank with hundreds of questions. We cover everything from pediatrics to hospice to, managing emergencies. But you'll use the promo code SPRING 2024 when you go to nurseeunice.com. One of the first links you're going to see available there is for the online CNA exam prep course. And I'd love to be your instructor and help you pass your CNA exam. All right, let's keep going. Number 5, which of the following prefixes means around or surrounding? Is it A, peri, B, sub, C, trans, or D, inter? Which means surrounding? Revealing the answer in 3, 2, and 1. Peri means surrounding. So explanation, the prefix peri indicates around or surrounding. So in the image that I have here, this person has periorbital swelling or edema and also some bruising. So maybe, she fell, she hit her head, but periorbital. So it's not the actual orbit or the eye socket that's swollen, it's the tissue around the eye. So peri means surrounding. The term cardiologist refers to a specialist in the field of A, bones, B, heart, C, lungs, or D, brain. This one's an easy one, cardiologist. And yes, I don't want to pronounce your name incorrectly, but is it Kihindi or Kihindi? Your answer was correct. And Musa, you've had correct answers also. And let's see for number 6. Cardiologist refers to a specialist who takes care of the heart. Very good, everybody. So a cardiologist specializes in the study and treatment of heart-related conditions. All right, number 7. What does the term hypertension mean? Is it A, low blood pressure, B, high blood pressure, C, irregular heartbeat, or D, blood clot? Hypertension. And if you chose B, high blood pressure, you are correct. So hypertension refers to an elevated blood pressure. So the top number or the systolic blood pressure reading is usually greater than 140. The diastolic or the second reading would be greater than 80. So if someone's blood pressure is greater than 140 over 80, we say that they have hypertension. 8. Which of the following terms means inflammation of the joints? Is it A, arthritis, B, dermatitis, C, hepatitis, or D, nephritis? So we know the suffix itis means inflammation, but which keyword means arthritis or joints? I gave you the answer, my bad. So the answer is A, arthritis. And the explanation is arthritis. Anytime you see ART, that usually means joints. So arthritis is the inflammation of the joints. Number 9, the suffix ectomy is used to indicate A, inflammation, B, removal or excision, C, the study of, or D, enlargement. What does ectomy mean? All right, revealing the answer shortly in 3, 2, and 1. Oh, yes, you have the correct answer. I'm so proud of you. The answer is B, the removal or excision. So explanation, the suffix ectomy is used for surgical removal or excision. For example, an appendectomy. So we remove the appendix. 10, what is the meaning of the term dyspnea? Is it A, difficulty breathing, B, rapid heartbeat, C, excessive sweating, or D, abdominal pain? All right, and so the correct answer is going to be revealed in 3, 2, and 1. It is A, difficulty breathing. So dyspnea refers to difficulty or labored breathing. And as a reminder, anytime you see DYS in front of a term, DYS is a prefix that stands for difficulty, and the PNEA refers to breathing. So DYS, difficulty, PNEA, breathing. Great job, everybody. You did wonderful. All right, so number 11. The combining form, it could be dermat or dermato, refers to which body part? Is it A, heart, B, skin, C, liver, or D, eyes? I see some of the correct answers coming through. And it means skin. So dermatologist. So B, skin. The explanation is the combining form of dermat or dermato refers to the skin. And when you look in the image here, our person has more wrinkled skin, drier skin. And so with the elderly, when their skin becomes more wrinkled and dry, it's more likely to break. You can get skin tears. You can also get pressure ulcers. So encouraging them to, hydrate, drink water, and to also use moisturizers is really important. 12, which prefix means within or inside? Is it A, intra, B, sub, C, trans, or D, peri? And we already looked at peri, so we know what peri stands for. So peri does not mean within or inside. Peri means peri stands for surrounding. And let's see what the prefix for within or inside is. And that would be intra, as in intramuscular or intravascular. So within the muscle or within the vasculatory system. So the prefix intra denotes within or inside. And you answered it correctly. I'm so proud of you all. 13, the term neurology is related to the study of, is it A, bones, B, nerves, C, muscles, or D, eyes? Neurology. And you all are correct. Yes, yes, yes. Neurology is the study of the nerves. So neurology is the branch of medicine that deals with the nervous system. So you all are doing so well. Let's continue. We have about 12 more questions left, and I'm going to try my best in running a full-time business, being a single mom, to get on and shoot these videos about 3 times per week to help you all study. So I have a lineup of videos, and if you want a specific video, you want to request a video, by all means, go ahead and put it in the chat or the comment area so that I'll know what type of video you want to see next. What do you need help with in order for you to pass your CNA or your nursing exams? All right, so let us continue. 14, what does the abbreviation CPR stand for in medical terminology? Is it A, cardiopulmonary resuscitation? Is it B, continuous positive respiration? C, critical patient recovery? Or D, central pulmonary rehabilitation? Yes, Chrissy, great job. Anyone else? I see. Yes, yes, Anselm. Yes, yes. All right, I'm revealing the answer in 3, 2, 1. All right, so CPR stands for cardiopulmonary resuscitation. So cardio meaning heart, pulmonary meaning lungs, resuscitation, the skills that we perform to save another's life. And so if you're trying to help their heart, you do chest compressions. Pulmonary, you'd be given rescue breaths. So in the image there, even though it's an image of an infant, we show 2 rescuers helping to save this baby's life. One is doing chest compressions, helping with the cardio, and the other is using a bag mask device to provide ventilations to help with the pulmonary part of the resuscitation. So CPR is a life-saving technique used in cardiovascular emergencies. 15, the term gastroscopy involves the examination of A, stomach, B, eyes, C, ears, or D, lungs. All right, revealing the answer in 5, 4, 3, 2, and yes, that's right. Yes, great job. Is the stomach. So gastroscopy. So when you put the gastro in front, that refers to the stomach. The oscopy usually have a scope or a camera. So it's a medical device that's used to examine the internal parts of the stomach. So in the image here, it looks like this person has some type of heartburn, but look at him still eating something that's going to irritate his stomach lining, as most of us do. So they take a scope, a flexible tube with a camera, and they can go in to see how irritated the gastric lining is, and they can also check for polyps, etc. So that would be a gastroscopy. And remember, if your patient has to undergo any of those type of procedures, they're supposed to be NPO, and NPO stands for nothing by mouth. All right, 16. What does the term hematology focus on? A, heart, B, blood, C, lungs, or D, kidneys? Yes, yes, yes. I see a few correct answers. Let's see. I'll give you about 3 more seconds. I'm going to sip my nurse coffee. I love my mug, everybody. Other nurses, and then, of course, the crazy nurse, me. Mm. Great job, team. You all did select the correct answer. It is B, blood. Explanation: hematology is the study of blood and blood related disorders. All right, so 17, the suffix ology is used to denote A, inflammation, B, study of, C, enlargement, or D, removal or excision. This one's easy. Ology. Psychology, neurology. Yes, I'm seeing some correct answers. Yes, yes, yes. The answer is B, the study of. So, explanation: the suffix ology is used to indicate the study of a particular subject, such as cardiology, gynecology. I mentioned psychology. 18. Which of the following terms means abnormal enlargement of the liver? Is it A, hepatitis, B, nephritis, C, hepatomegaly, or D, gastritis? I want you to think about this. ITIS doesn't mean enlargement. ITIS means inflammation. So it's not A. Give me a different answer, everybody. Yes, Lindy, you got it. So anytime you see megaly at the end of a word, that usually means mega. It's big. So hepatomegaly means inflammation of the liver. And so that can happen whenever someone drinks a lot. They could have cirrhosis. They may have a fatty liver. But hepatomegaly, and of course, you all know that the hepato part, that meant liver, it refers to the abnormal enlargement of the liver. And what you can usually see is a swollen abdominal area. The patient may be complaining of some pain. 19. What is the meaning of the term ophthalmology? Is it A, the study of the heart, B, study of the eyes, C, study of the skin, or D, study of the lungs? Ophthalmology. Yes, Chrissy, great job. Here we go. 3, 2, and 1. Yeah, so we're talking about ophthalmology. It's the branch of medicine dealing with the eyes. And I'm not sure if you can see it, but this person's sclera, the whites of the eyes are not white, they are yellow. So when anyone's sclera is yellow, one of the conditions they may have It could be jaundice related to liver disease such as hepatitis. So when your doctor's doing their examination of the eyes, they can find underlying conditions that the patient may not be aware of. 20. The term renal is associated with which organ? Is it A, heart, B, lungs, C, kidneys, or D, liver? Your patient has renal failure. Which organ is failing? Ooh, this one's making you think a little bit. Renal failure. Revealing the answer in 3, 2. Yes, yes, yes. We have some correct answers. Yes, great job. Renal refers to the kidneys. So renal, as I just said, pertains to the kidneys. So when someone's kidneys fail, their body becomes toxic because your kidneys do multiple things. So in addition to your kidneys filtering, the byproducts, the blood, they're filtering things out. And then if you can urinate, you would go ahead and expel the extra potassium, the extra calcium. But whenever the kidneys are not working, the body becomes toxic. And as a result, the patient may end up being on hemodialysis. And what we normally say is just dialysis, but it's more to it than that. The hemo part means that we actually take their blood out of their body. We run it through a machine that cleans the blood, and then we circulate the clean blood back into the body. So the machine takes out the waste, it takes out the excess fluids, and it works as the kidneys because this person's kidneys are not working. Some people will only need dialysis temporarily. Some may need it for the rest of their life. Your person needs to be on a low potassium or a renal diet because, again, their body can't excrete those extra nutrients. And so just be very mindful of their diet trays. And if they're getting something that's high in potassium, that can actually cause them to go into cardiac arrest. So those diets are important. So great job for knowing that renal means kidneys. All right, 21. What does the prefix poly in medical terminology mean? Is it A, one, B, many, C, none, or D, few? Poly. Think about the word polygamy. What does the term poly mean in medical terminology? All right, so when someone is a polygamist, they have many wives. So poly in the medical term also means the same thing. Yes, it means B. So explanation, the prefix poly denotes many or much. And the main time you're going to hear poly is polyuria. So poly prefix meaning many, urea means urine. So your diabetics, especially when their blood sugars are high, they will have polyuria. They'll be urinating a whole lot. And that is when sometimes we'll order urine specimens because we want to see what's coming out. Are the proteins, are the sugars in the urine? So the time that you'll normally see polyuria is if, of course, we have a whole bunch of IV fluids going or if the person's blood sugars are abnormal. All right, let's go to the next one. 22, which of the following terms means inflammation of the liver? This is easy. This was a freebie. Everyone should get this right. Is it A, hepatitis, B, nephritis, C, gastritis, or D, dermatitis? Yes, Lindy, you are correct. Yes, Saved by Grace, you are correct. Yes, Anselm. Anselm is not nephritis. Nephritis refers to the kidneys. So that's another term. Neph is also referring to the kidneys. So everybody, the answer is A. Hepatitis refers to the inflammation of the liver. And if you stayed with us this far and you haven't subscribed to our channel, go ahead, make the commitment. You know I'm your favorite nurse. So go ahead and subscribe. And of course, we would love to, continue helping you study and grow. And we do more than just CNA videos. We also do CPR, business development, nursing videos. We are here to help you succeed regardless of your career path. 23. The term tachycardia is characterized by A, slow heartbeat, B, fast heartbeat, C, irregular heartbeat, D, no heartbeat. Tachycardia. Tachy. And I want to say, yes, Lauren, yes, Linus. It's a lot of names I can't pronounce, so I don't want to mess them up. So the correct answer is going to be B, fast heart rate. That's tachycardia. And so your patient may complain of, my heart is racing. They won't say they have tachycardia. But what you would do as a CNA if you saw this on the monitor is, number one, get your patient safe. If they're walking, get them sitting somewhere. If they're in the bed, keep them in the bed and notify your nurse. Because if the heart starts beating too fast, the blood pressure can drop, and of course, the patient will become dizzy, and we don't want that happening. So, tachycardia is a common condition, and it usually relates to abnormally fast heart rate. That's a medical emergency. Notify your nurse. 24. What does the term arthroscopy involve? Is it an examination of the joints, examination of the heart, examination of the eyes, or examination of the skin? Arthroscopy. The arth part. I gave it away last time. Arth. Kind of sounds like arthritis, doesn't it? Arth. Yes. Anytime you see the ARTH, that refers to the joints. So the answer for 24 is going to be A, an examination of the joints. So arthroscopy is a medical procedure involving examining the joints. And when you look at this person's hands, there are different types of arthritis. Not all of the arthritis cause deformities. Some can just cause pain. In this image, this person's hands are now deformed. This is a sign of rheumatoid arthritis. So there's different types of arthritis. Some of them actually cause more inflammation in certain areas, especially at the joints. And look at her fingers. So, and of course, this is a painful condition. You want to allow these persons to perform range of motion. If you just let your patient stay in the bed all day, they don't move, that's actually going to worsen their pain and worsen their condition. So even though it may hurt a little, you still want them to participate in their care, comb their hair, feed themselves. Otherwise, they're going to become more debilitated, and that doesn't help anybody. All right, 25. The term pneumonia primarily affects which organ? Is it A, the liver, B, lungs, C, heart, or D, kidneys? When someone has pneumonia, which organ is affected? Yes, that is the correct answer. Yes. Yes. Great job, everybody. I'm doing my nurse dance over here. I probably should have kept the camera on. But B, lungs, explanation. Pneumonia is an inflammatory condition of the lungs. And so you want these persons to take deep breaths in and out. They usually have devices like an incentive spirometer to help exercise those lungs. It's going to hurt when they cough, but they need to cough. They need to bring up that excess mucus. So everybody, thank you all for watching. My name is Nurse Eunice. I'm the owner of Florida Training Academy. If you want to take a live CNA exam prep course, we have those courses here in Jacksonville. But if you want to download our free study guides or take our online course, and I apologize that the screen isn't showing correctly, you would go to nurseeunice.com. Don't forget to send me a note. You can go to the community post. Let us know what videos you want to see in the future. And our goal is to come back on here about 3 times per week and help you pass your exams. You all have a marvelous, a wonderful day. And I'll be making a new video today. I'll be going into this room next, and we'll be actually doing complete bed bath. And so let me go set up the next station. I'll see you all in a few hours. Bye.